All right, good morning, everybody. We will go ahead and get started. So my name is Jen Gall, and I'm the Education Program Manager for ACI, and we're happy that you guys are here with us this morning. So our goal over the next hour is to shed light on how mental health issues are becoming more common in our industry during this time of uncertainty, and to discuss how employees can cope with what the new normal will look like in the coming weeks and months as we transition back into the workplace. So we wanted to provide this opportunity to hear from some experts on the medical, economic, and human resources perspectives as it relates to mental health. So please use the chat feature at the bottom middle of your screen to share any additional questions that you might have for our panelists this morning. And we will do our best to cover all of them in the hour that we have together. Excuse me. If we are not able to answer all of the questions, please know that this is being recorded and we will send additional answers with the recording next week. And if you have a private or company specific question that you have for one of our panelists, feel free to contact me at ACI and we will get that answer for you. So with that being said, I would like to introduce our four panelists today, and as I introduce each one of them, they will go ahead and give you a quick intro of what they do, where they work, and what perspective that they're bringing this morning. So first up, I would like to introduce Jennifer Pearson, the Senior Director of Marketing and Outreach with the Lindner Center of Hope.
Thank you. Good morning, everybody. Thanks for being here, and thank you to ACI for hosting this discussion. As mentioned, I am with the Lindner Center of Hope, which is a comprehensive mental health center located in Mason, Ohio. We provide mental health services and services for addiction as well. And over the last year or so, we have really engaged more with the business community in discussions about mental health and how to bring that more to the forefront in order to not only help employees, but businesses overall in terms of productivity. Thank you.
Great, thank you. So next up, we have Laura Jackson, a specialty treatment provider with TriHealth.
Hi, good morning. Thanks for having me. Very important topic, and certainly a lot of unknowns and uncertainties as we're going through a time like this. So I represent TriHealth EAP, that's Employee Assistance Program. So we work with over 200 companies locally and nationally to provide employee assistance. So that's counseling, drug-free safety, substance use evaluations, trainings, supervisor consultation, just kind of the whole gamut to support our companies. And I personally am a counselor, a licensed social worker, and addiction specialist. So I've been in behavioral health field for about 14 years. So I will be speaking to that. Thanks for having me.
Thank you. Next, we have Deirdre Bird, who is the Director of HR Consulting from Von Lehman CPA and Advisory Firm.
Great, good morning. Thank you so much for having us. I'm Deirdre Bird, and I lead the HR consulting practice at Von Lehman CPA and Advisory Firm. So what that means is we provide a variety of HR services for our small to mid-sized business clients. Anything from being an outsourced HR department or being HR on call all the way through to leadership training, management training, and coaching. So today we'll focus in on the aspect of how human resources and organizational methods and systems can help employees with mental health.
Thank you. And then our last panelist is Natalie Thompson, an HR consultant from Von Lehman CPA and Advisory Firm.
Good morning. Hi, everyone. I'm Natalie Thompson, also an HR consultant with Deirdre at Von Lehman CPA and Advisory Firm. In addition to what Deirdre shared about who we are and what we do, we're just really excited to be here as we're passionate about employee well-being and engagement. I'd like to thank you, Jen and Susan, for inviting us, and ACI for hosting this important discussion.
Absolutely. Okay, so we're now going to transition into some of the questions for our panelists. So the first two questions this morning are for Laura. So most of us have likely been affected by mental health in our personal lives in one way or another. And many of us probably have our own definition of what mental health is. But Laura, what does the term mental health really mean?
Well, when I think of mental health, I think kind of in the simplest, purest form, it's brain health. So when you think of what makes up us as humans, you've got our brains, our bodies, all different things. We talk about heart health, bone health, gut health. This is brain health. So just like our other parts of our medical and physical health, we need prevention, we need check-ins, maintenance to keep our mental health up to par and keep us feeling good. I don't love the term mental health because we can all remember the times when it really carried a lot of stigma when we'd say somebody was mental or crazy. And generally, even though of course there are mental illnesses, in general, when we talk about mental health, we're not talking about the serious stuff. It's stuff that we can all relate to: stress, some depression, maybe some worry, anxiety. And when our stress is affected, like in a time like this with all these big changes, everybody's feeling stress. I think stress is a word everybody can relate to.
Thank you. So going off of that, what are some common signs that could indicate someone is having a problem with their mental health that we might not necessarily recognize in coworkers or family or even in ourselves?
Sure. I think when we talk about stress, the big ones that we might notice in ourselves or in our family and in our coworkers are sleep, changes in sleep, not sleeping or sleeping too much, changes in appetite, kind of the same, not eating enough or maybe eating too much, stress eating. And then maybe an increase in anxiety and worry, just can't turn your brain off, can't fall asleep because you're just thinking and worrying and the what ifs, that kind of thing. Those are all signs of stress or mental health, possibly mental health issues. Then you've got kind of the end where you're depressed, maybe losing motivation, lack of energy, struggle to get up and get going in the morning. That's kind of the mood stuff where you really may notice in yourself or others. And then I think changing habits. So maybe you're isolating and maybe you're a social person and you don't want to get on the Zoom happy hour call, or you really find yourself just kind of coming home from work or keeping to yourself, and it's a change for you. You got maybe increase in alcohol use or drug use. You see physical ailments. So when you're not feeling good or when your stress is high, you may notice increased headaches or upset stomach, muscle tension, just your aches and pains that you kind of normally feel. Everything is just exacerbated by stress. So I think those are just kind of the practical signs to notice, especially in yourself. When I think about coworkers, you might not know if they're sleeping or not or eating or not. And so we're doing more of visual cues, like do they look okay? Or you're also listening to the words that they're saying. So maybe they just kind of are talking doom and gloom, or they just don't seem like themselves, or you're noticing just a change, and maybe a change for the worse. And so in my years, and especially when I think about manager consults and consulting with HR specialists, so many times after the fact, the person will say, I kind of knew something was going on, or I noticed a few months ago and I just didn't know what to say. I think as far as coworkers or your team, your employees, trust your gut. If you feel like maybe something's going on with somebody in your workplace, there probably is. I would say trust your gut on that.
Great, thank you for that. So now that we've heard from Laura on some of the signs and symptoms of mental illness, let's transition to mental health as it pertains to the workplace. So according to businessinsider.com, the average person spends more than 90,000 hours in their lifetime at work, and that obviously can affect their personal lives. So Natalie, why is workplace mental health so important?
It's so important because an employee cannot be fully engaged in their work or with their colleagues if they're dealing with untreated mental health issues. In a study by Mindshare Partners, 67% of workers said their productivity was affected by their mental health, and 37% of those workers said that their work environment contributed to those symptoms. If employees are actively disengaged, it can cost an employer 34% more than an employee's annual salary. And actively disengaged workers will likely leave the organization. Given the talent shortage in construction, it's imperative that employers take a holistic approach when supporting their employees. When employees have less distractions and are given the right guide rails and support to do their best work, they're not only more productive and engaged, they're also less likely to have accidents and fatalities.
Great. So building off of that, from the human resources perspective, how can employers be more proactive when it comes to mental health in the workplace?
So Jen, I think of three things an employer can do to be proactive when it comes to mental health in the workplace. The first one is an employer can share resources with employees. Laura mentioned about employee assistance programs, so reminding employees about those programs that they have, pointing out an HR contact for employees to ask questions, and providing quick access guides for suicide prevention lines, crisis text lines, disaster distress helplines, and domestic violence helplines. A second approach an employer can take is they can start to create a caring culture. Leaders can lead by example. They want to make sure that they're human and that they acknowledge the struggle as well as share best practices. Leaders can be vulnerable, transparent, and honest, and employers can share optimism and confidence where applicable because it gives employees hope and helps relieve their anxiety and fear. Another way to create a caring culture is to make sure that you review your harassment and bullying policies. You want to remind employees that we're all in this together. We're all experiencing the same anxiety, uncertainty, and fear about COVID-19, and that harassment, hazing, or bullying of any kind, including coronavirus related, is not tolerated. Leaders also want to make sure that they're reaching out to their employees on a regular basis. The more that leaders can communicate with their teams, the better. They want to check in with their employees, ask them how they're doing with changes to their work situations, and obviously all the major changes that are happening in their home situations as well. And employers can also show appreciation and show that you care about the employee well-being. The last strategy an employer can take is they can start to normalize the conversation. One construction company, they added members to their safety team. And in addition to checking safety that goes beyond just physical measures, such as ensuring that the equipment is functioning correctly, they took the time to get to know the workers personally. They asked questions about their lives, and they were able to see sensitive changes in their demeanors. If your organization already has a wellness program and does biometric screenings, one other benefit you could add for your employees is you could consider offering mental health screenings at the same time as your biometric screenings. And then another construction company, they would host lunch and learns where representatives from the Lindner Center of Help or TriHealth, they would come and present on their benefits they provide to the community and resources that they can share with them. So in summary, if employers want to be proactive when it comes to mental health in the workplace, they can share and connect employees to applicable resources, creating a caring culture, and start to normalize the conversation.
Great. Those are all really good points. Thank you. So our next question is for Jennifer. So according to Workplace Strategies for Mental Health, 82% of employees with mental health issues indicate that mental health impacts their work. So how does mental health impact the bottom line for businesses?
Well, mental health has an enormous impact on the bottom line. There is quite a few statistics that really give us examples of how that is happening. In the US alone, the economic impact of mental illness in terms of direct and indirect costs and lost productivity is truly staggering. Compared with the magnitude of mental illness as an economic and public health problem, we really only spend a tiny fraction on provision of care. So it really doesn't make sense that we're not accessing care and helping people get connected with resources because it's really costing us more. It has been proven that spending too little for treatment means higher costs and lost wages. and also productivity, as well as the toll in human suffering in terms of disability and premature death. So the impact is, playing out over a period of time for sure. According to the National Institutes of Mental Health, depression costs an estimated of $23 billion in lost workdays every year. And depression alone affects up to 17.5 million US employees, who in turn use about 8.8 million sick days. And that's because they have had untreated depression or mistreated depression. So again, not accessing appropriate resources is really costing businesses quite a lot. And then, as you can imagine, the pandemic now is building up additional concerns when it comes to mental health. People now are feeling more stress and more concern, and even reentry, as that begins to happen, we're going to see people feeling concerned about coming back into the workplace and whether or not they'll be risking potential exposure to the virus, and whether or not they might be bringing that home to families. So going forward, we're going to see the pandemic kind of play out long term in mental health impact. In addition, just really the costs associated with untreated mental illness have and will be considerably higher than the cost of treatment itself. So again, I think it's really important for businesses to start considering, the bottom line and helping employees to get connected with resources before anything else.
Thank you. Yeah, those are some staggering numbers when you really think about it. So our next question is also for you, Jennifer. So we all know that starting workplace conversations about mental health is challenging, and conversations about it outside of the workplace are challenging. But are there any programs that can help employers bring more understanding and unity to the issue of mental health in the workplace?
Yes, as I mentioned at the introduction, the Lindner Center has been working more consistently with businesses on helping to start the conversation. I mean, we really understand that, in the break room or around the water cooler, people are having discussions about the fact that, oh, I just had a knee replacement, or, where do you go if you need to have, a colonoscopy perhaps, or things like that. People are sharing that information, but when it comes to mental health, we really take a step back and consider, is that something I want to ask about, or is that something I want to share? So our program, Start the Conversation, is in partnership with Tier 1, which is also a Cincinnati area business. And it really began as a way to touch businesses and help them with a formula to open up the conversation amid their employees. The format of the program is really over a 4-week period of time. And the goals are, first, to kind of educate participants about the signs and symptoms of mental illness, really touching on the common ones so people know how to identify those. In addition, it provides resources to help employees to really document family history, including mental health. Again, it's very common that we share amongst our family members, grandma had cancer, so that's a risk for us and our family, or grandpa had heart disease. So again, people are thinking about that, but we're not talking about mental health issues such as bipolar disorder or anxiety disorders. And those are things we really need to start to track and share amongst our families first. Additionally, we provide additional information to learn more about mental illnesses. So we do this through a website that has a lot of information for employees to access. And there's also an email plan where employees are receiving consistent emails with information kind of triggering discussion and triggering research into mental illnesses. And again, overall, the goal is really to increase awareness. We also work to reduce the stigma surrounding mental illness. So there's prompts to really encourage conversation or encourage people to interact with others about what they're learning and about just the information that's being shared. We do a pre and post survey as part of the program. And really what that allows us to do is get a read on how how much an individual knows before they participate in the program about mental illness, and then afterwards what the change has been. So it really provides a good metric. And finally, we've found that the more vulnerable company leadership is in that process, the more successful the program tends to be, because employees really feel inspired by the modeling that they're seeing from their leadership.
Great. Yeah, I know that we've had Mike Glenn out to ACI to talk to members about that program, and it really is such a great resource. So on the topic of programs to help employees, this next question is for Laura. So how can EAPs improve employee mental health, and what other resources beyond EAPs should a worker consider taking advantage of?
Yes, thanks. And I just want to start by echoing what Jennifer just said. The most successful companies we see in terms of wellness and being a caring culture come from the top down. So if your leadership really can be a little vulnerable or speak the language that it's okay and ask for help when you need it, those kind of simple messages, that's when we really see a big impact. So the reason I like EAPs, employee assistance programs, first of all, it's just easy access. So if we're kind of a starting point for just about anything. So anything's going on with any team member or employee, EAP is a good referral. And we can do that initial intake and assessment and get them where they need to be if we're not the place for them. So it's easy access, it's free because it's employer paid, which means that it is separate than your personal health insurance. So virtually kind of no record, which I think people like. Even though it's employer paid for, it is still confidential by law, like all mental health services. And so that's the extra piece of comfort to maybe encourage employees to access. The second reason I really like EAP is that everybody speaks the same language. So the companies that we serve, they know what TriHealth is. They know TriHealth EAP. So if somebody looks upset, or somebody's maybe spouse just died of cancer, or there's a troubled employee, they're calling off every Monday, and it's like maybe there's an alcohol issue. All of those things, with these different levels of referrals, you can make a informal referral to anybody, and anybody can do that. Like, hey, I see that you're struggling. Have you thought about calling your EAP? Or kind of more of a formal thing. If it's an issue and you want to take a more formal approach, I think we do, and some other EAPs probably do that too, of more of a mandatory referral. It's like this person didn't really take initiative for himself to go in and just kind of do this on their own, so we can kind of bump up the referral and make it more of a mandatory thing. With other resources, and I know especially in the construction field, and I think sometimes just men in general struggle to think about calling a counselor. So another kind of backdoor way in is just referring somebody to their doctor. Like, hey, looks like you're not doing well. Have you checked in with your doctor lately? Maybe, just do a checkup with them as a counselor. I get a lot of referrals from somebody's just primary care physicians. Like, yeah, I went in for a checkup, and after we talked for a little bit, she really suggested that I need maybe a little more, and maybe I'll try this. But I really like kind of the points that Natalie made of, providing just in the break rooms or whatever, the quick access points, the hotlines, the EAP numbers. You just put them everywhere. The one company we work for, they put our EAP cards on the vanity in the bathroom, because they say, like, it's a private place. Sometimes you go in there to just take a deep breath or wash your hands, and that card's there with our name and number, and the access, I think, and the reminders are good. And then the caring culture, like you said, and to normalize, hey, everybody needs help for a variety of things. If your blood sugar was going up and down, what are you going to do? You're going to call the doctor. So if your moods are up and down, or you're really, every morning is a struggle to get out of bed, you need to call somebody. And when I meet with somebody, often I'll tell them, the research shows most people are feeling better in 4 sessions, as little as four sessions. That's, in the next few weeks, in the next months, you're probably going to be feeling better. And so it's just kind of providing people that hope that, hey, you're worth it. You don't need to live like this. Maybe, and I think for a lot of us, it's like, wow, it got worse than we thought. We've just kind of been feeling bad for so long. We maybe didn't really recognize how bad we've been feeling, but just a little bit of hope that, hey, things can be better in a short amount of time. So, and I think Susan had said when we spoke yesterday that she was putting together a resource list of that you were going to share today. Is that right, Jen?
Yeah, we can share that with everybody after the panel is over. We'll email it out just so it's easy access. But yeah, we'll have a list of resources, which I think will be really helpful.
Great, definitely.
Awesome. Thank you for sharing that. So our next question is for Deirdre. Since the COVID-19 stay-at-home orders were put in place, many people are working from home. So how can employers create a positive team culture in our current situation where folks are working remotely?
Thanks, Jen. And actually, I want to step back just a second to the prior question too and build on what Laura was saying. One of the things as employers that we love about the EAP program too is that it's not just for employees, but for immediate family members. And so sometimes our stress comes from what's happening in the circumstance around us. And that's certainly the case too with working remotely. For employees who are not used to working remotely, or perhaps are used to it, but suddenly this remote work environment looks very different for those employees. So there's a lot of uncertainty and ambiguity in this time in and of itself. And then you add on some additional discomfort in doing something different. And that can really create for employees all over discomfort, and certainly for those employees working at home. For employees working remotely, one of the challenges too can be they are missing out on one of the things that they had when they were in the office, and that is that connection to other people. So it can be isolating. It can feel like being on hold with no hold music. And so we recommend to leaders in the organization, leaders at all levels and coworkers, communicate. That is one of the best ways to help make sure that employees that we're creating a positive team culture. We don't have to be all in the same location to have that same culture. So in that communication, we recommend communication that's deliberate and it's consistent and it's frequent, probably more frequent than what you would think you would need, because nature abhors a vacuum. This is a period of time when employees are looking for information. They're with that uncertainty, they're looking to fill the void. Now is a good time to rally employees around the mission and rally employees around this common purpose that we have. So the communication for employees, if it's mission focused, it also can tell employees the answers you do have, but you don't have to have all the answers. So you can let employees know if a question comes up or concerns comes up and you don't have the answer yet. It's okay to say, I don't have the answer, or to refer an employee to the best resource. You don't have to be a doctor. You can refer employees to the CDC, for example, on information related to COVID. So you can also, within the organization, seek ideas from employees. And what you're doing in all of that communication, helping employees stay connected, helping employees know what you do know, and having that sense of direction, along with being able to ask for help, creating a culture in which it's okay to do that, is so important in this time. And also important is when an employee raises their hand, when they ask for help, to make then addressing those concerns a priority for employees. That goes a long way in creating a culture that is supportive, a culture in which the whole team feels then connected because you're rallied around getting through this unusual period of time.
Great, thank you. So we have made it to our last prepared question, and then we'll check for any that the audience has submitted. And then if you are watching and listening and you do have a question and you'd like to submit that now in the chat box, we'll review that here in a couple minutes. So I would like each of our panelists to answer this question if you'd like, but we'll start with Jennifer. So the question is, how can managers and leaders create a sense of belonging during this unprecedented time?
Yeah, I think a lot has already been covered in terms of this, but just to kind of summarize what we believe are some of the key points from Linder Center of Hope's perspective is really connecting beyond the work and building really a more personal relationship, and knowing your employees is really essential. Um, Already talked about too is kind of sharing experiences and making sure that folks are aware that we're all in this together seems to be really a critical message. And Deirdre really covered a lot as well about over communicating during this time. You know, it's time really to err on the side of over communication rather than under communicating. It really helps to build transparency, and from that really grows trust. And that seems to be really important, especially during a time where people are trying to feel like that they belong, and that the environment is safe. And then from a very basic level, everybody can just care for your team, for providing a psychologically safe space for people to connect. I already mentioned modeling vulnerability from a leadership perspective. It helps really to listen openly and just be present for folks. Thank you.
Thank you. And I'll just go in order of how I see you ladies on my screen. So Natalie, if you'd like to make any comments on that question.
Yeah, so kind of back to what we've already shared is just making sure that you are intentional about creating a caring culture. These are small things that you're going to have to put in place on a daily basis, just so that they become habit. And then before you know it, 6, 8, 9 months down the road, they're just ingrained in the culture. And it's just what the leaders do, and it's just what the employees do, is really care for each other. And in doing that, obviously, to hit home again, the communication piece, just make sure you're really communicating on a regular basis with employees. And in doing that, reinforcing their importance and value in the workplace, as well as their importance and value in their community.
Thank you. Laura?
Yep, good things. Everybody's kind of touching on all the good things. I would say when you talk about care and concern and how to show it, it's simple things like, how we all get caught up in the day and the work, and you go into the conversation of how's the project going, or what's the update on that VC job, whatever it is. It's just taking that first step to say, how are you today? Really? Are you doing okay? Oh, this has been stressful. And using that word stress when you're talking about mental health, that's generally just a safe word. It's a relatable word. We can all relate to stress. We can say kind of blanket statements. We're all stressed during this time. So that's kind of a safe place to start. And then just to follow up, the worst thing to do is nothing. If you have a gut feeling somebody's stressed, you're really concerned, share your concern. It's kind of when we talk about like even suicide prevention, the old kind of myth of like, oh, we don't want to bring up suicide. We don't want to give somebody that idea. That has been totally eradicated. That doesn't happen. So if you have some concerns for somebody, it's better to share your concern and tell them that, hey, I noticed you. Maybe you don't look so good today. Thanks.
Thank you. Deirdre?
So we've touched on so many important pieces, the communication that's needed, creating a culture that's consistent over time. One of the other things we found with our clients is helping employees for a moment get away from some of the stresses and anxiety that they might have regarding COVID, for example. So seeing, is there a way too we can help with some socialization in our normal workplace? That's a part of what happens, and that's been put on hold here with social distancing. So are there ways that we can help foster other social ties that will help people continue to find joy in their workplace? So maybe that's even a virtual coffee break or a friendly competition through an end of the day company-wide trivia game. But in addition to the leadership, making sure employees are connected, helping employees connect with their coworkers, and continues that sense of belonging and engagement with the organization.
Great. Thank you. So again, thank you to all of our panelists for the great discussion around those questions. So I'd like each of you to kind of give us some final thoughts for folks to take away from today's discussion, and then we'll go to, we have one question that someone has submitted. So we'll do the final thoughts first, and Laura, we'll start with you.
Okay. One thing I was thinking, what would my final thought be is what's really unique about this situation about being in a pandemic is that across the board, we are all going through it together. It may look different. It may have affected individuals and families a little bit differently, but it's a unique kind of connectedness. So I think in that way, it can be unifying to join us together of like, wow, this is something that only happens every 100 years and we're in this together, and just kind of to be the light and the hope for other people that this is hard, but we're going to get through this together, kind of showing some of that resiliency that humans have.
Thank you. Jennifer?
One thought that I would have is really just continuing along this idea of normalizing mental health issues. I like how Laura has really talked about referring to it as stress, as a way to open up the conversation. But going back to the idea of how do we make this a normal part of our day-to-day, where we're truly asking people how they're doing and how they're managing, and being really willing to listen to the real answers to that. Mental illnesses are really common, and they're also very treatable. And so no one really has to struggle alone. And it's just an opportunity to help people access resources so that they can have a really successful and functional life.
Thank you. Natalie?
Yes. So just because we're social distancing does not mean we have to social isolate. Kind of to Deidre's point and to Jennifer and to Laura's point, we really need to have the sense of community, but in this new virtual world. Employers can really play a key role in influence and impacting an employee's well-being, including giving them the tools to manage their health.
Thank you. Deirdre?
Right. And really, everything that we've heard so far from Jennifer and Laura and Natalie, I will emphasize, absolutely. We think that making sure that as leaders, we are connecting with employees, that we take the time for the additional communication that helps employees have a sense of belonging, whether that communication is communication that we provide to a large group, or that one-on-one communication, and both are so critical in this time to make sure that we're providing that broad communication to a large group, and that supervisors, managers, other leaders in the organization have those check-ins with employees. And that underlying message in all of it can be confidence and optimism that we can get through all of this together, as difficult as it may be in the moment, and that transparency in terms of really being human in terms of where we all are, but recognizing we're experiencing some of those same things and we can get through this together, including reaching out and supporting employees whose struggles are, they might be at a different spot in those areas.
Great. Thank you all for your final thoughts. Those are really great. So I'll go to our question that I see in the chat box. So I assume this question would be for Laura. So what advice can you provide to employers that observe a worker who seems to be in a crisis? And then second part, how should coworkers handle a situation such as someone appearing unstable?
Yes, I think this is something most people can relate to in some point of their career. So kind of piggybacking on what I said before, it's the worst thing you can do is nothing. So pay attention to your team, to your employees. When you notice something, try to intervene early. Try to intervene on that informal level when you're just sharing your concern and you're suggesting maybe they see their doctor or an EAP counselor. I think you want to pull them off of work. I mean, the best thing, especially from like an HR perspective, is you're always thinking liability. So if there's any question, you just want to pull them off of the job and get a second opinion. So that's where an EAP really can be can be handy. It's like they can usually get them in the next day, same day, next day. And we're going to have a professional look at them and see what is going on. Is this, somebody who maybe just needs to be hooked up with counseling, or is there something more serious going on that needs some more serious measures? And then just kind of that culture of open door policy. So if a coworker is noticing something, they should always feel comfortable to go up to their one-up in a confidential, anonymous manner to say, I'm really worried about so-and-so today. I'm seeing this, this, and this. And then those actions from the manager can be taken.
Great. Thank you. So that's all that we have today. And again, this was recorded and we will get the recording sent out early next week. So again, thank you so much to all of our panelists. This was really great. And thank you to everybody who hopped on to spend your morning with us. And we hope that this was helpful in getting all of us transitioned back to the workplace in a safe and healthy way. So have a great day, everybody.